You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Hey everybody, so my name is Dr. Malcolm Winkle. I'm one of the PGY4 residents at SUNY Downstate. Can you guys see my slides? Can you guys hear me?
Yeah, we can hear you well, seeing all the slides well, so you can
All
go
right,
ahead
beautiful.
and
Yeah.
start.
So welcome everyone. Good evening. I know that 25 minutes is going to be really difficult to talk about an entire residency program. So I listed out my email, and shout out to Dr. Lucas and Dr. Johnson who are in the chat right now. So I listed their addresses as well in the email. Plus also we have Instagram. So just in case you have any questions which are not satisfied in this talk and everything, please DM us, contact us. We'll feel free to speak to you guys and everything. Just some background about me. I'm a PGY4 resident at SUNY Downstate, and I did my medical school training here, and I did my internal medicine prelim year here as well, and I stayed on for the residency. So that kind of speaks itself to the sort of strength of the program, and I hope this talk will give you a sense of like what is going on in Brooklyn, you know? So the PM&R residency program, the division of PM&R at SUNY Downstate offers a 3-year residency training program, fulfilling requirements leading to eligibility for certification by the American Board of Physical Medicine and Rehabilitation. So usually per year, we take about maybe 7 to 8 residents for the PGY2 slots per year through the match. And so our residents come from various backgrounds in terms of preliminary year training. So some folks do transitional years. I myself did a medicine year, but some of my other colleagues who are really great did surgical years. So all that sort of blending of medical experience helps to guide our training and helps within the later years between PGY2, PGY3, and PGY4. This next slide just shows some of our core faculty members and some of the graduate residency graduates from our program and everything. We've matched pretty strongly within pain fellowships, plus sports and spine fellowships and sports medicine programs, and also neuromuscular training and everything. And within the bottom screen here, you can see Dr. Keefley. He's one of the main Kings County Hospital attendings. Dr. Stickevers, she's our program director. Dr. Sanjeev Agrawal, he's our division chief, and he's also board certified in PM&R and pain medicine. And the beloved Dr. Bayol has been in the program for over 30 years, and he's amassed a quite great amount of wealth while working at Kings County, which is a level 1 trauma center. So right now we have about 5 main clinical sites, which include SUNY Downstate, Kings County Hospital Center, St. John's Episcopal, Staten Island University Hospital, and the VA systems, which actually were brought in about 1 year ago or so. Just a pro tip about what I'm going to be talking about later on. SUNY Downstate and Kings County Medical Center both count as level 1 trauma centers, so you'll be seeing things like polyneuropathies to TBIs and spinal cord injuries. So like things all across the sort of PM&R range, including prosthetics and orthotics at both facilities. St. John's Episcopal Hospital is mainly one of our sites that we see like a lot of consultations, nerve conduction studies, but also a lot of procedures as well, including fluoroscopic guided procedures. Staten Island University Hospital is another one of our level 1 trauma centers where you're going to be seeing the full spectrum of PM&R, including nerve conductions and EMGs. And the VA center is only bolstered that kind of profile because now we get so much exposure to prosthetics and exoskeletons and various things, mainly at the Bronx site, but then at the St. Albans site, there's a lot of inpatient rotations where residents get to medically manage our sickly patients. And at the Brooklyn VA, there was a lot of procedural exposure as well to nerve conductions and fluoroscopic procedures, plus also ultrasound guided procedures. So the first program I wanted, the first rotation site that I wanted to speak about was SUNY Downstate. That's our main rotation site where we see the inpatient care, outpatient care, consultation services, sports medicine, and interventional pain management. So here you typically have about maybe 7 residents or so. 1 resident's running the floors while 1 is running the consult service, and 5 residents are running the outpatient services. You also have access to our physician assistants in native, who's really great. The inpatient side, we run a 20-bed unit where you're seeing patients who are being worked up for spinal cord injuries, medically complex rehab, including myelopathies versus rheumatologic disorders. And we also do consultations that range from the surgery service, medicine service, the pediatric surgery service, the ICUs, the CCUs, and the NICUs as well. And the outpatient clinic basically stands for the Parkside Clinic, where we're seeing various musculoskeletal disorders, so including lower back pain, radiculopathy, shoulder arthritis, and various things like that. You also see general PM&R, including TBI, strokes, prosthetics, and orthotics, and we have a dedicated prosthetics and orthotics lab where those devices are actually made. That's right down the block, which we also have a very commonly referred to physical therapy gym called Motion PT, where we send our patients to start physical therapy and everything. But also at Parkside, we also get a lot of exposure to sports medicine, to ultrasound, regenerative medicine, and that's also dedicated time for the orthopedics clinic. So we get like a lot of exposure to hand surgery, spine surgery, general orthopedics, pediatrics as well. So you're also rotating with them, foot and ankle as well. And you're seeing both the non-operative side of things and also the operative side of things. Also at Downstate, we do Botox clinic, migraine clinic, and the EMG clinic, which is a collaboration between PM&R and neurology. So a lot of our neurologists are actually neuromuscular fellowship trained as well. So they also sort of blend in with our sort of clinical exposure, and we get dedicated time for reading radiology reads for orthopedics and for neurosurgery as well. This is just another photo of our fluoroscopy suite with Dr. Aguilar there, showing us one of the transfemoral procedures, and one of our training dummies right there. I think his name is Bob, but maybe Phil, but I don't really remember at this point though. And the next site we rotate at would be Kings County Hospital, which is another level 1 trauma center. So you're going to be seeing the full spectrum of PM&R there. Typically there's about 5 residents that are split between the inpatient side and the outpatient side. For the inpatient side, we typically see about maybe 25 patients being discharged plus admitted on a weekly basis and everything. The outpatient clinic, you'll be seeing mainly bread and butter PM&R cases, in addition to spinal cord injury, musculoskeletal, prosthetics, and orthotics, and we also share the nerve conduction suite with neurology as well. So you'll be splitting time between seeing nerve conductions between PM&R versus neurology as well. We have dedicated prosthetics and orthotics and wheelchair clinic. And on Thursday mornings, we also do diagnostic ultrasound grand rounds, where we talk about different cases and scan patients and practice our procedural skills through the AMSSM guidelines and procedure logs. And so call schedule at Downstate typically reduces from the PGY 2-year to the PGY 4-year, and calls can be taken at home so long as you're within a 20-minute radius of the hospital for any sort of medical emergencies. The next day, so post call, you're off the whole day. So you're 24 hours on and then 24 hours off. And then the next rotation site would be Far Rockaway, the St. John's Episcopal, where there's typically 5 patients being split between the outpatient clinic and the consultation service, where we see prosthetics and orthotics, nerve conductions, pediatric consultations, but we also get consulted a lot for OBGYN for any sort of foot drops, and we also get procedure exposure to fluoroscopic procedures through the anesthesia department there as well. And our next clinical site would be Staten Island University Hospital, LIJ, which is another level 1 trauma center. So we see a lot of multiple sclerosis in addition to rheumatologic disorders, TBI, spinal cord injury, some autoimmune as well. And that's what I pretty much said. We also have a dedicated burn unit there as well. So a lot of patients like who have level 1 trauma may also have a burn injury, whether it's, level 1 to level 3 or so. So we'll also see those patients and, medically manage them as well. So the call at Staten Island, one resident is usually assigned to take call on the weekdays until about 6 o'clock or so. And like around 6 o'clock to 7 o'clock or so, we sign out to the on-call hospitalist who would then cover the floors overnight time and help us out until that time. For the curriculum, we pretty much run through Cocorillo twice throughout the whole year. Dr. Stegevers, she's board certified in PM&R and pain management. She runs the board review for all of New York State and everything through the NYS PM&R meetings. So she literally walks around with a bunch of flash drives with like lectures and everything. So she runs through the entire gamut of the Cocorillo book, plus also her own personal lecture slides from being a director at both Stony Brook and also at SUNY Downstate. The lectures are typically held on Thursdays from 1:30 to about 5 o'clock p.m., which includes lectures, but also dedicated time to the Socratic app, where we're going through like a bunch of questions through our phones, and like we have mock exams about every 3 months or so, doing those questions and everything. So that helps to bolster our sort of grades and everything for the SAEs and in general our clinical knowledge. And this is just a slide kind of outlining the sort of curriculum we go through. So it's pretty comprehensive. Procedural exposure, I pretty much went through all that between like the different sites, including Parkside, Staten Island, St. John's Episcopal, Kings County, and everything. For the evaluation process, residents are evaluated mid-rotation and also at the end of rotation so that the attendings can give sort of feedback as to where you are within your postgraduate year, PGY 2, 3, and 4. You also get the evaluations by your peers as well. So it helps us sort of guide you where you're at and see like where your sort of deficiencies are so you can get better. And for each resident, there's a minimum of presenting at least one poster at a presentation. So I myself have presented about 3 cases because of the fact that we have so much exposure to so many diverse cases between those multiple sites. I've presented at AAPM&R, the American Sports Medicine Society, because so I'm applying for Sports Medicine Fellowship this year. So also AAP, and some of my colleagues have presented at multiple pain societies and also neuromuscular societies as well. So in terms of research, we also have collaborations between the orthopedics department, the neurology department, and PM&R. So you always have like some opportunity to sort of fill that need for research and everything. This is just a slide talking about some of the posters that we've presented. We give, residents a lot of books through the Google Drive and everything. Benefits, just in case you want to look at this slide, you can DM me for the sort of benefits, but you get paid sick leave, malpractice insurance, and a $1,000 stipend, plus also a iPad Pro as well through the program. We also have a sports medicine fellowship run by Dr. Christine Prasad, who's family medicine trained. So we get exposure to a lot of sports through SUNY Maritime, through USA Boxing. We do football coverage within the fall, and we also have exposure to the Special Olympics and the PSAL. And PGY2 residents are exposed to, are paired up with PGY4s with like similar interests. So for PGY2 is really interested in pain medicine, they get matched with somebody who's applying to pain, and they sort of get the understanding of what it's like to go through that sort of gamut of like applying to fellowship and everything within that sort of time spectrum, so they understand what's going on there. And we have our wellness committee, which is ran by, I believe, one of our co-residents in PGY4. So we really want to make sure that everybody's doing well, especially during this time in COVID where there's so much burnout and stress. You know, there's always like a new wave and a new variant of COVID. So we want to make sure that you guys are well taken care of, and we host multiple wellness events to make sure that we all are supporting each other and taking care of each other, which is also kind of concurrently ran through our diversity and inclusion committee, which I was the chair of for the past 2 years or so. So we also take pride in the fact that we want to make great doctors, but also great people who understand the sort of context that our patients live in and how that sort of biopsychological and social factors impact our patients and their health, and how we can help to manage them better.
We have about 5 minutes left.
Gotcha. We have an acupuncture certification, which is ran by Dr. Sai Chow. This course is actually ran at multiple places, including Harvard and UCLA, but the cheapest place would be at Downstate. And you can then be a certified practitioner of acupuncture through us for a much reduced cost. We have Instagram. There's Dr. Johnson, super smiley. A bunch of our residents and everything going to dinner, and one of our Botox sessions being run. And this is a bunch of our residents and fellows at the American Medical Society for Sports Medicine conference a few years ago. And I put a plug in for some of my contact information here, Dr. Annette Lucas's and Dr. Johnson Ho's information, just in case you guys want to reach out. And thank you guys for listening to me. If you have any questions, please shoot them at me. Oh, let me check the chat real quick. Where do most residents live? Mostly within Brooklyn and Manhattan. But to be honest, during my PGY 2 year, I was living in Queens and commuting via the Lure train to Brooklyn or so, which is about a 40-minute commute by train or so. Well, 1 hour from door to door between my house and SUNY Downstate or so. So whether you live in the Bronx or Brooklyn or somewhere else within the program and everything, that's not an issue. Do some residents have families with kids? Absolutely. One of our residents who's applying to pain right now, she has a child as well. Do you get pain exposure as a PGY2? PGY2 is mainly focused on the inpatient side, so you're learning to manage medically complex patients, but we have plenty of lectures and pain workshops that's hosted by Downstate, but also at Mount Sinai or some of the other residency sites. And also we have connections with the New York Society of PM&R because one of our residents is a treasurer of the society. So like we get exposure to pain through that sort of culminative meeting in a way.
We have about 2 minutes left.
And let me see what other questions we got. Where do most residents live? Pain exposure, I think I answered that. Pain exposure, PGY2, yeah. You'll get exposure to musculoskeletal pain, which is more peripheral, through our ultrasound guided workshops, and you also get Botox exposure. So that's more so spasticity pain, but the main fluoroscopic pain exposure will be between your PGY 3 and 4 year, where you're actually working at Parkside. But of course, you can always network and find opportunities like with other attendings to, get the exposure for the sake of applying to pain fellowship. So I hope that sort of answers your question. You're welcome. Yes. So again, quick plug. So if you guys want to contact us, we have Instagram. I put in my email address. I'll keep it up right here if you guys can see it, just in case you have more questions, because I know this was like a really tight sort of thing to get through. So please, my email is mwinkle@gmail, lucas.net@gmail, Johnson Ho. So hit us up if you have questions and let us know. And we're very responsive.